within days of putting their secret Senate version of Trumpcare on the floor. We're hearing reports they may have a bill in draft form, but there has not been a single hearing. The bill isn't posted anywhere, and there's been no opportunity for public scrutiny of this bill. And I have to say, based on what I'm hearing, I'm not surprised, because given everything we know about the way Senate Republicans are approaching this, they are going to jam something through that follows the same disastrous playbook as the Trumpcare we saw that passed the House. Higher costs for families, especially seniors and those with pre-existing conditions, Planned Parenthood defunded and maternity care gutted, millions kicked off of Medicaid coverage they rely on, all to deliver a massive tax break to special interests in the healthcare industry and hand President Trump, who has called his own Trumpcare bill mean, a hollow political win. Well, I'd be ashamed of that bill too, and we are here today to focus in particular on one issue that is deeply concerning to me, and that is the impact that Trumpcare, and specifically the way it slashes Medicaid, would impact our military families whose children have disabilities. By gutting Medicaid, as they're planning to do, Senate Republicans would even put military children with disabilities at the risk of losing coverage that they rely on depending on where their families are transferred. Right now, in many states, Medicaid offers wraparound services coverage to children with disabilities to fill in the gaps in their parents' insurance. But cutting hundreds of billions of dollars from Medicaid would force states to make hard choices about who and what to cover. So if a military child with a disability moves to a state that decides to cut benefits, including wraparound benefits, they may be forced to go without the care they need. And families that choose to, families in states that choose to block grant Medicaid would be at serious risk of not having their child covered under Medicaid. Now, some Republicans have even said that families can just move to another state if they can't get the coverage they need. Well, I don't think anyone should have to move because Republicans in Congress decided to undermine their health care. But for military families, picking up and moving is not an option. That's not just mean, it is appalling. Putting military families at risk of losing their child's coverage, especially on top of the service sacrifices they're already making, is simply unacceptable. And it shows just how far Republicans are willing to go to carry out President Trump's extreme agenda. So I'm very honored to be here today with some people who can speak to this personally, Kathryn, Katy, and Will, to make the case for why Republicans need to drop their Trumpcare once and for all and protect our families, especially our military families, from the harm it would do. And with that, I'm again very proud to introduce Kathryn, who is here to tell her story of what this actually really means. Kathryn, come on up.
Thank you, Senator Murray. I appreciate the opportunity to speak with y'all today and share my story about my family. It's one of love, devotion, and challenges. I'd like you to imagine this: a family of 6, 2 parents, 2 children, and 2 grandparents. One of the children is 17 years old with cerebral palsy as a result of a near drowning when he was 18 months old. He is nonverbal, non-ambulatory, and requires total care for his daily activities of living. The grandparents are diabetic, one with Alzheimer's, the other with renal failure. One of the parents is active duty military, subject to new orders and possible transfer every 3 years. For most, this scenario is difficult to imagine, but for me, this is my reality. I've moved 6 times during my military career. Like most families, with each move, we face challenges finding a home that fits our needs, the right school district, good child care. These moves are stressful and challenging at the best of circumstances. We and families like mine deal with those issues and then some. We must find dependent care that is capable for caring for the unique needs of our family members. In my case, it is my son and my in-laws. It's far more difficult than you may imagine. Currently, we have Medicaid waivers for both my son and my in-laws. They provide much-needed attendant and respite care in addition to assistance with medical needs and durable medical equipment. However, Medicaid is not portable. With each move to a different state, reapplication and requalification is required. This process can take up to 6 months to complete, and in the meantime, the out-of-pocket expense for aid coverage can be up to $5,000 a month. In addition to the actual filling out of the paperwork, the system complexity itself can be overwhelming. There are different waivers for each with different focuses and varying levels of coverage and varying wait times for that coverage. You may qualify for more than one, but which one fits your needs the best? For us, the one that fit the best was a 3 to 5 year wait list. I was encouraged by my son's developmental pediatrician to apply for a less inclusive waiver just so we could get some benefits. The process took 6 months and involved steps from 3 different governing agencies and 3 different home visits. Because I already been through the system once with my son, the time qualifying for my in-laws was less. With 3.5 months, we had coverage for them. However, during that time, we paid out of pocket for their aid, medication, and personal needs, effectively depleting our savings. Requalification was more complicated. You don't know who's responsible for what, who to talk to get the answers you need. For instance, after requalifying, to get payment authorization for my in-laws' aid, it took 6 weeks of phone calls to no less than 17 individuals before I got the answers and the results I needed. Without the help of one individual, I still would be working the phones and coming up empty. Just when you start to understand the system, it's time to move again. The thought of having to start the process all over again in a new state with a new system is daunting. My in-laws' time on this earth is limited. My son will be with me for a long time. He will need assistance the rest of his life. Realistically, his needs will only increase. However, keeping him at home with family is the best placement for him and for us. I consider it an honor and a privilege to care for these incredible people. It has given me a new perspective on life and has shown me what is truly important. We owe them the best that we have, and we are, for as long as we have them. That's what makes us human. Thank you.
Thank you, Kathryn. Thank you very much. And with that, we'll hear from Katy first.
Thank you, Senator. It's an honor to be here. Easter Seals is dedicated to advancing the independence and well-being of children with disabilities who rely on Medicaid for essential home and community-based services, including those who live in military families or who are veterans. As currently configured, Medicaid guarantees specific services to children with disabilities. And unfortunately, the American Health Care Act, passed by the House of Representatives and under consideration in the Senate, would remove that guarantee through a per capita cap or a block grant to the states. As you've just heard from Kathy, we simply can't tolerate that. The Senate must reject these policies. Historically, Medicaid has been the only source of health insurance that adequately meets all the needs of children with disabilities. Prior to the enactment of the Affordable Care Act, many families with children with disabilities impoverished themselves so their child could access essential services like physical therapy for a child with cerebral palsy, behavioral health for a child with autism, or speech therapy for a child who has difficulty eating. Families with other sources of insurance, including TRICARE, the military insurance, could also buy or otherwise access Medicaid to supplement the gaps in services. With nearly 100 years of service of experience, Easter Seals knows that Medicaid has proven to be life-changing and effective for children with disabilities. We urge the Senate to reject the American Health Care's policies on Medicaid for 3 important reasons. One, as you've heard, it will jeopardize the health and well-being of children with disabilities in military families. It will make it more difficult for children with disabilities in military families to get an appropriate education. And 3, it will make harder for military and veteran families to access home and community-based services through the Medicaid waivers. Kathy's laid that out completely beautifully for you. This is not something that's easy or casual or anything that doesn't affect every element of a family. It does. We have decades of research on the developing brain that demonstrates the overwhelming value of early intervention services to young children with complex needs, including those who have autism. Unfortunately, many kids with autism are not diagnosed until they're about 4. The TRICARE program limits behavioral health services to kids who have a formal diagnosis of autism. So for those kids who don't yet have that diagnosis, but who need behavioral health, they're out of luck. It's Medicaid that provides that supplemental service for these children at this critical time. And most military families don't have the means to pay out of pocket for these services if they're not covered. Again, as Kathy mentioned, most military families have multiple assignments. They move many times while their children are in school. For those kids that need special education, moving to a new school district every 3 years can be difficult. Some school districts welcome these children and their families and develop and implement appropriate services, while other school districts slow walk these families, not wanting to invest their limited resources on children who are only going to be moving on. Cuts in Medicaid will only make these challenges more severe. Lastly, current Medicaid policy allows children with significant disabilities to receive their services at home rather than at a hospital. Again, as Kathy said, her place for her son is with her family. It's not in a hospital, it's not in an institution, it's at home with their family. The terms and conditions spelled out in waivers are individual to each state. And at any time a family moves, you have to start the process from the very beginning. We're very concerned that the proposals before us are only going to make waiting lists longer and access these essential home-based services more difficult. We urge the Senate to maintain and improve and not diminish the essential health and long-term services currently available to people with disabilities through the Medicaid program. It's an honor to be here today as a person who's done disability policy for the last 30 years. Disability has always been a bipartisan effort with members of both sides coming together. We urge the Senate to remember its history in disability policy and bring both sides together and to not cut Medicaid and make the lives of these families more difficult. Thank you, Senator.
Thank you so much. And Will.
Thank you, Senator Murray. And good afternoon, everybody. My name is Will Fischer. I'm an Iraq War veteran, a United States Marine, and I'm the Director of Government Relations for Vote Vets. And I can't tell you how many times since over the last few months during this healthcare debate and conversation, someone's asked me, well, how is this a veterans issue? Don't you just all go get your health care at the VA? Well, here's the reality. Millions of veterans, including me, yes, we do receive world-class health care through the VA. At the same time, though, there are millions of others who aren't able to. They aren't eligible to receive health care through the VA, or they simply live too far away. So here's the reality. As such, 1.75 million veterans in this country are currently covered through Medicaid. And 40% of that number, that is their exclusive means of having access to health care. 1.75 million veterans are enrolled and have medical coverage thanks to Medicaid. And it's all over the place. It's 56,000 veterans in Senator Murray's home state of Washington. It's 45,000 veterans down the road in Arizona. And it's 15,000 veterans on the other side of the country in West Virginia. Here's the reality. Here's the reality. If one supports Trumpcare, if one supports this gutting of Medicaid, they are leveling a broadside attack on veterans and military families, an attack that might not be one that can be sustained. So, what I just want to make clear to all the senators is that as the largest progressive veterans organization in the country, with over 500,000 members in all 50 states, it will become our main mission to let people know where you were on Medicaid and where you were on Trumpcare. And if you vote to punish veterans by ripping away our ability to have access to health care, then you're not going to be able to go to church, You're not going to be able to go to a community event. You're not going to be able to go anywhere in your district, in your state, without your constituents knowing and being able to point at you and say, hey, look, there's a senator that thought it was a good idea to punish veterans by taking away their health insurance. Y'all take care. Thank you.
Well, thank you so much. And thank you to all of you. It is so clear the Republicans are moving forward. They are putting together a bill in secret in a back room. They intend to bring it up shortly. Now is the time to raise your voices, talk to your members of Congress, tell them no, do not repeal health care, do not damage Medicaid, don't hurt our veterans, don't hurt our children with disabilities. We are a better country than that. Thank you. Thank you all very much.